Hello, my name is Rene, and I'm very happy to participate in this IRSSD scientific meeting online this time, but hopefully I'll see you all again in Hong Kong next year. I'm looking forward to that. My topic for today is innovative imaging for scoliosis. These are some disclosures, at least two of them are related to the topic of this presentation. And as we all know, the standard way, the gold standard for assessment and follow-up and treatment of scoliosis is a standing X-ray. And I show you here only the AP, but of course the lateral is part of the examination protocol. There's some other modalities that we can choose, like CT scan, probably more indicated for congenital cases and the more severe ones where the bony anatomy is very difficult to distinguish. But we also have MRI, which is not too good in the normal circumstances for bony detail, but can give a very beautiful picture of the neuraxis and of the discs. We have the EOS that has less radiation exposure than standard radiography. And of course, we have also ultrasound. We know that especially the CT scan, but also the standard X-ray and also even the EOS has some radiation issue that may be a concern, because this is the number of X-rays that patients receive in our department. We have an interval of usually 6 months. That could be more frequently in the more severe cases. So it could be 4 months, but usually it's like 6 months. And for the follow-up, we only take one coronal X-ray, not standard the lateral, unless we have some issues or concerns in that field. But the more severe the curve becomes, you see that the more frequent these X-rays become, and especially in the surgical cases, we have AP and lateral X-rays just about at any visit. So that can really add up. And we have to realize that children are notably more sensitive to the carcinogenic effects of ionizing radiation. These studies that I will show you now have addressed that, and this study by Prasuti shows that a patient with AIS who undergoes operative treatment receives approximately 9 to 10 times more exposure than the background radiation. And that means that the lifetime solid cancer risk really increases. This study by Anne Simoni goes into that a little bit more in detail, and in her study, which is very widely quoted, she concluded that the patients treated with bracing or surgery had an overall cancer rate of 4.3%, which is 5 times higher than that of an age-matched Danish population. So I'd like to talk to you about 2 novel radiation-free imaging techniques. One of them is ultrasound, the other is bone MRI. And I think they're both very promising in our efforts to reduce radiation. Ultrasound of the spine is not totally new. In 1989, Suzuki wrote a paper on his technique, which was pretty elaborate and not very widely used at that time, but he was able to demonstrate that with ultrasound that had a lot of interest for infantile hips, for instance, at that time, but you could also visualize the scoliotic spine. But as I said, it was not widely followed up and widely used. That probably changed when this system came into use that was developed in Hong Kong by Telefield Medical Imaging. And that was able to provide a full-length spine ultrasound only in a very short period of time, less than a minute maybe. And it provides a freestanding image of the spine without any radiation, as you can imagine. So obviously, if you use ultrasound, the image provides different detail than if you have an X-ray. And on the X-ray, we have by tradition been focused more on the anterior elements like the vertebral bodies. It's not necessarily logical why we did that, but that made it easy to obtain that Cobb angle that is so widely used and is such a standard. And of course, in ultrasound, you don't really see those anterior elements. And since in scoliosis, the anterior elements rotate away further from the midline than the posterior elements, if you look at the anterior elements, you see more of a curve than if you look at the posterior elements. And that's what the patient always sees. They're always surprised and actually pretty shocked if they see their X-ray, because from the back, if you look at the patient or if the parent looks at the patient, the curve appears much less than what we see on the X-ray with the much farther away rotated and more tilted vertebral bodies. And the ultrasound really gives an image of the posterior elements. But you can see quite good detail, and you can see the line of the spinous processes, as you see here in continuity, but you can also see the most tilted spinous processes and create an angle, but you can also see the transverse processes and create an angle. And we did a study, and many studies were done in Hong Kong also, but we did a few studies that looked at the reliability of these different coronal images. And if you see this graph, you see that the radiographic cup angle and the automatically constructed spinous process angle really corresponds to a great extent, and is really something that can help you in following your patient and assessing the severity of the curve. And it's only a matter of agreement that we, at a certain point, chose to look at the tilted vertebral bodies. But of course, there's a one-to-one relation between the anterior vertebral bodies and the posterior structures of the spine. And we might as well decide that from now on, we will look only at the posterior elements, and our values will change a little bit, but the principle of the scoliosis that we're looking at will not change at all, of course. And here you see some examples of how ultrasound is very well able to follow that spinal curvature and really demonstrate the different curve types. So in our practice, we try to avoid the X-rays as much as possible, which means that at entrance into the department, the patient gets an AP and lateral X-ray and an ultrasound, and then if possible, and if there's not an immediate concern for surgery or brace treatment, or to follow up the effect of brace treatment, we try to do that as much as we can with ultrasound, thus avoiding a great number of X-rays. And only when the ultrasound angles really change, I think it's an indication to go for the next X-ray. So I think that's much to the benefit of the patient. There's different options, and we've looked at that. You can even do bending ultrasounds, which look relatively similar to what you see on the X-ray. We have followed some patients after operation to see if there's any change in the area of the construct. And of course, the advantage of ultrasound is that it gives you a real-time image in space, and you can ask the patient to rotate a little bit. You can ask the patient to move around while you're still having your ultrasound probe on the back, and you can follow these different motions, which is like fluoroscopy in the radiology world. But of course, this one is without any radiation. You can also look at the sagittal plane. It needs to be reconstructed. It's a bit more complex, but we have, with a large group of people, large group of researchers from Hong Kong, and I think I'm the only one non-Chinese in this group, who have looked at the lateral shape of the spine, and also that is a very welcome and very important addition to our possibilities. Exciting development is something that we also have in our department. That's the ScolioScan Air, where we can, in our outpatient office, can have that available for us, so we can really follow the patient when we see them, and get a nice image. The other thing that is something that may be future is that this information, these data, can be used to recreate a model of the spine that makes it probably a little bit easier for most of us as surgeons to look at the image, because we recognize the spine much more than on the ultrasound. But it's sort of a gadget that I think could be helpful in the future to really get this into a accepted and much more widely used technology, because I think that's worth it. Now, the question here is this CT? And the answer is no, it is not. This is MRI, which is, as we know, very well capable of visualizing soft tissues like the disc and the spinal cord, but usually was not able to give such good detail of the cortical bone, and also not of the cancellous bone and differences in structure that occur in that field. But through deep learning and AI techniques, this group from Utrecht, group from the University Medical Center, was able to really recreate very accurate cortical bone images that really are equal and equivalent to the CT image, with the great advantage that you don't have any radiation, but also the great advantage that it's a one-stop shop. People come in, have an MRI, and from the MRI, the soft tissue can be analyzed, but also the cortical bone CT, or synthetic CT as it is called, can be created. And here you see some examples of how accurate these images are. And we have been trying to put that to use for our scoliosis patients, and I'm happy to say that by now it is possible also in the moving areas of the chest, with all the vessels and the respiration. It is possible to obtain very accurate and very precise images of the bony anatomy of the spine that you can also rotate around like you would on a CT scan. So I think this is a very promising development. And one of our colleagues in the United States, Kees Poelstra, he's Dutch from origin, but he works in the US. He did the first robotic navigated spine surgery recently in November 2022. So in conclusion, I say that radiation reduction should be taken seriously by all of us. The history and the clinical exam of the patient really tell a good story and give you a lot of information also of the 3D shape of the spine and the thorax. Ultrasound is available, it's portable, reliable, and can be used in an outpatient setting. It's dynamic, it's upright. Bone MRI is, of course, less available. It's more in the hospital setting. It's supine, but it can provide great bony and soft tissue detail, very comparable to CT scan. Can be also used for navigation, really reducing the radiation burden to the patient. And I think this development deserves to be continued. And I thank you for your attention.